Hi there, I'm Ashton Sawatzky. I'm going to be doing scenario number 5 for you today for the med demo for class 2530 nursing skills. So I'll be starting today by comparing my physician's order with my MAR. So we have the patient, Jake Nursing, Finn 312, 312, 654, 654, 987, 987. Date of birth is January 1st, 1960. Here we have January 1st, 1960. Dr. Skills Lab, Dr. Skills Lab. Today is March the 4th, 2020 at 09:45. There is no known allergies, so that is the same. Now I'll be comparing the medications. Prednisone, right drug. 10 milligrams, right dose. PO, right route. It's a suspension, an oral suspension. Daily at 10 o'clock. It is 09:45, so it's the correct time. I am indicated to give that medication. So we have next Timolol 0.5, right drug. One drop, right dose. Left eye, right route. And daily, but it's supposed to be given at 2200 hours. It is now 09:45, therefore it is the incorrect time, and I will not be giving this medication right now. Amoxicillin, right drug, 250 milligrams, right dose. PO, right route. BID, to be given at 10 o'clock. It is 09:45, so that's the correct time. Therefore, I am indicated to give this medication. Warfarin, right drug, 2 milligrams, right dose. PO, right route. Daily at 10 o'clock. It's to be given, and it's 09:45 right now, so therefore it is the correct time. I am indicated to give this medication. They have all been double signed, so they have a transcriber and a nurse signature, and therefore I am indicated to give these medications as they've been properly transcribed from the physician's order. So I'll be flipping that over, putting that off to the side, and now I can begin collecting my medications. So I'll do some hand hygiene here. First, we have our prednisone, 10 milligrams to be given. It's 5 milligrams per milliliter, so I will be giving 2 milliliters today. It's a PO drug. This is an oral suspension. And to be given daily at 10 o'clock, it's 09:45, so this is correct to be given right now. Next, we have our amoxicillin. It's the right drug, 250 milligrams, so it's 250 milligrams per tab. So I'll be giving 1 tab today. It's a PO drug. This is an oral tab, and it is BID. So it's given at 10 o'clock, and it's 09:45 right now. So this is the correct drug to be giving at this moment. Next, we have Coumadin, also known as Warfarin. According to my drug cards, these are the same medication. 2 milligrams to be given today. This is 1 milligram per tab. So I'll be giving 2 tabs, which is 2 milligrams. This is a PO drug. This is an oral tab to be given daily at 10 o'clock. It is now 09:45. So these are all the correct times and medications to be given. So next I will be preparing my medications. So I'm going to do some hand hygiene here. And then I'm going to start with my prednisone. So I'm going to check that all of my drugs have not been expired. So here I see it is not expired. My amoxicillin is not expired, and Warfarin here is not expired. All right, so hand hygiene again, and then I will be preparing my prednisone. So I'll shake my suspension to make sure it's all lifted off the bottom. And now I do not want to contaminate this lid, so I'm going to be putting it upside down. Next step is to be putting it into the cup. Put the lid back on and put the mid off to the side. I'm going to do my hand hygiene again just to be careful. All right, so we have 2 milligrams today, as I said. Be real careful to not touch the tip of the syringe to the bottom. So I just want to check that we have no bubbles today. Looks really good, but just to be certain, we'll just pump those bubbles. All right, and I'm putting this lid off to the side, just being certain that when I'm holding it, I'm not touching the top. Sorry about the background noise. Our window is open. All right. Mildly distracted, which is why you keep the med door closed. I just want to be right on this line here. Okay, great. So you'll see there's a little drop here, which might be a little bit distracting, but good. Okay. So I'm putting this in the lid and I'm performing hand hygiene. This is my med waste, so I'm putting this off to the side to be discarded with. And I'll make my med label. So we got Jake nursing. Drug name is Prednisone. Dose is 10 milligrams. Volume 2 milliliters. Concentration as per the bottle is 5 milligrams per milliliter. Date is March the 4th, 2020, 09:45, and we got our signature and designation. I'll put this off to the side for you to look at, and I'm just gonna grab this and put it off to the side too. Okay, great. All right, next step is gonna be my amoxicillin, doing some hand hygiene here. Just gonna grab these to prepare for my meds. So my amoxicillin, 250 milligrams, so I am giving 1 tab today, as 1 tab is 250 milligrams. And make my med label. So we got Jake nursing, amoxicillin, dose is 250 milligrams, volume is 1 tab, concentration is 250 milligrams per tab, March 4th, 2020, 09:45, my signature, UMSN2. Okay, and I'll put this off to the side with my med label and just good to make sure. Do my hand hygiene. And lastly, we're preparing our Coumadin here, which is Warfarin. Going to be giving 2 milligrams today, which is 2 tabs, 1 milligram per tab. All right. Jake nursing is our patient. Drug is Warfarin. Dose is 2 milligrams, volume 2 tab. Concentration is 1 milligram per tab. Date is March the 4th, 2020 at 09:45, and give my signature and designation. All right, thank you. Okay, I'll put this off to the side. I'm gonna do my hand hygiene again. And now I'm going to do my second check. All right. So, start with the top, Jake nursing, correct patient, prednisone, and this is prednisone on the syringe. So we got the right drug. 10 milligrams, 10 milligrams. This is 5 milligrams per milliliter. So I've given 2 milliliters today, so that's the right dose. And as per my concentration I've written, it's 5 milligrams per milliliter, so that's correct. This is a PO drug, so this is an oral suspension here as well, so it's the right route, and given daily at 10 o'clock. I've written here it's 0945 to be given on March the 4th, and therefore I am indicated to give this medication as it's to be given at 1000 hours. So that's all good. So we can put this one back into the med cabinet, put my med back onto my little tray here, and do my hand hygiene. Next is our amoxicillin. So we have Jake nursing, correct patient. Amoxicillin, and that's amoxicillin, so right drug. 250 milligrams, 250 milligrams, 250 milligrams per tab. We have one tab in here. So it says PO, that's a PO medication, a PO tab, and to be given BID 10 o'clock. It is now 0945 on March the 4th. It has not yet been given, therefore I'm indicated to give this medication. Okay, put that back into my med cabinet. Hand hygiene again. And last we got our Warfarin. So this is Jake nursing. We got the correct patient. We have Warfarin, and Coumadin is the same as Warfarin. And this is Warfarin in here. That's the correct drug. We have dose is 2 milligrams. It's 1 milligram per tab, so I've given 2 tabs today. It's a PO medication, so this is an oral tab. And I will be giving it daily, 10 o'clock. It is now 0945 on March the 4th. It has not yet been given. I have that here, March the 4th, 0945. So that's the correct time and frequency. So I'm indicated to give this medication. I'm going to just draw attention here again, just to be certain. Timolol, this is the eye drop that's due at 2200 hours. It is 0945, so I'll not be giving that medication right now. Okay, so I'm going to be taking some water to my patient for these oral medications. And I believe that should be all I need. Okay. As I'm entering the patient's room, I'm just doing a safety check, making sure there's nothing on the floor. Patient is not in distress. Hi there, sir. I'm Ashton Sawatzky. I'm a student nurse, and I'm just performing hand hygiene. I'm going to be giving you some medications today, okay? So before I start, I just want to confirm a couple things about you. So what is your name, sir? Okay, so Jake nursing. Great. And what's your date of birth? Okay, great. So January 1st, 1960. We have here January 1st, 1960. Good. I'm just going to confirm your PIN number. So we have 312, 654, 987 and 987. And your doctor is Dr. Skills Lab. I see that that's the same on your bracelet, Dr. Skills Lab. Sir, do you have any allergies? No, you do not. Okay, that agrees with your bracelet. That looks great. And also my mark. No known allergies. Okay, great. Thank you so much. So I'm going to raise you up to a comfortable height for me to work with. So I'll raise the bed to my hips. And I'm also going to raise you up to high Fowlers, okay, sir? So we'll just raise you right up there. There we go. You look great. Okay. So I'm giving you 3 medications today. Before we start, I'm just going to do my 3rd check over here, just to make sure that all these medications are in fact correct. So I'll do my hand hygiene here. And now, so I will be, we're looking at, okay, so we got, you can come on over here if you want to. So we got Jake nursing, right patient, prednisone, and this is prednisone, right drug, 10 milligrams. The concentration is 5 milligrams per milliliter, and we have 2 milliliters here, so that's the right dose. This is a PO suspension. This is a PO drug, so we have the right route. Given daily at 10 o'clock, it is 0945, and here it says March the 4th, 0945, March the 4th, not yet been given, so I am indicated to give this medication. We've checked all of the rights. Next up is our amoxicillin. So we have Jake nursing, correct patient, amoxicillin. This is amoxicillin, we have the right drug, and this is 250 milligrams, so that's the correct dose. It's 1 tab for 250 or 250 milligrams for 1 tab. There's 1 tab in here, as you can see. This is a PO medication, PO drug, so that's the right route. And we have BID given at 10 o'clock. It is now 09:45, so that's the correct time, March the 4th at 09:45, March the 4th at 09:45. So I am indicated to give this medication. Again, I'll just say I'm not going to be giving the timolol today, as it is to be given at 2200 hours. It is now 09:45. And lastly, we have our warfarin to check. So we have Jake nursing, correct patient, warfarin, correct drug, that's warfarin. 2 milligrams, 2 milligrams. It's 1 tab per milligram, and we have 2 tabs in here, so that's the correct dose. It's a PO drug. This is a PO tab, so it's the correct route, and given daily at 10 o'clock. It is now 09:45 on March the 4th, 09:45, so I'm indicated to give this medication as all of my rates have been confirmed. Okay, great. So I'm going to do my hand hygiene again, and I'm going to just chat a little bit with the patient and just educate them on what they're receiving today. All right, so sir, you're going to be receiving 3 medications. First one is going to be your prednisone. So this is an immunosuppressant drug. This drug is so that your immune system will receive the kidney that was just transplanted for you. While you're on this drug, make sure you're not drinking any alcohol and you're not stopping the drug abruptly. We're going to, if you're experiencing any of these side effects, please let us know. They're common, however, not normal. So our side effects today are going to be headache, any muscle pain, or any insomnia. So do ring the call bell beside you if you experience any of those. And I've already assessed this patient's need for an immunosuppressant. Additionally, I've assessed if they have any adrenal insufficiency. I've also assessed if they have any immunosuppressant disorders already. And I've assessed if they have any diabetes or peptic ulcer disease. And they do not have any of these conditions. They are an appropriate patient for this drug. So I'm going to be evaluating this patient to make sure that their immune system response has decreased, also that their inflammation has gone down. Additionally, we've assessed that they have no allergies to this medication, therefore this is appropriate to be giving at this time. So we've already assisted the patient up into high Fowlers for this medication. It's very important that they sit like that while they're receiving oral medication. So we'll just do hand hygiene here. Start with our prednisone. So we have, all right, sir, would you like to take this medication? Here we are. So it's an oral syringe, great, and water. Okay, sir, I see that you've swallowed this medication completely. That is great. Okay, next is our amoxicillin. So this is an antibiotic. This is for your respiratory infection. This antibiotic, while you're on it, make sure that even if your signs and symptoms have gone away, that you still go through the full duration of your therapy. Also make sure that you're taking 6 to 8 cups of fluid while you're on this medication. Keep that oral intake up. And if you experience any fever, any diarrhea, or any rash, these are very important to let us know. They're common side effects, however, not normal, so we do want to hear from you if you're experiencing any of those. I've already assessed the patient to see if they do in fact need an antibiotic. I've assessed the area of the bacterial infection. I've also looked at the results for the CNS, and therefore this is the best antibiotic for their current bacterial infection. I have also assessed if they have any asthma or allergies that might cause a hypersensitivity. I've additionally assessed if they have any hepatic or renal dysfunction or if insufficiency, and as that would change their dose. And I have assessed if they have any hypersensitivities to this, as well as other cephalosporins or penicillins, and they do not have any hypersensitivities to any medications at all. So this is safe to be giving. I will be evaluating to see that their bacterial infection is resolved, and that should be that. So, all right, sir, if you're ready for the amoxicillin, It's right here. Okay, and some water. I see that you've swallowed that medication. Thank you so much. All right, do hand hygiene again. And our last drug today is going to be our Warfarin. This is an anticoagulant. This is going to prevent blood clots. While you're on this medication, don't be taking anything with aspirin, as it could cause abnormal bleeding. Also, if you experience any abnormal bleeding at all, or if you notice any blood in your stool, let your healthcare provider know as soon as possible. This is very, very important. While you're on this medication, if you experience a headache, dizziness, or fatigue, that's also important to let us know. These are common side effects, however not normal. We do want to hear from you. I've already assessed this patient's need for an anticoagulant. I've also assessed if this is an appropriate dose for their age, and I am indicated to give this medication. I will be assessing to be seeing that they have adequate blood flow and that they're not having any issues with those blood clots we're talking about. Okay, hand hygiene again to be nice and sharp. All right, sir. So we have our Warfarin. Here you are. Some water. Okay, I see you've swallowed that. That looks great. Thank you so much, sir. All right. So I'm going to be signing off on all of these medications. So we have our Prednisone. So that's my signature. 0945 UMSN2. Not signing for Timolol, as I did not give that. Amoxicillin I did give. 0945 UMSN2. And Warfarin at 10 o'clock, 0945 UMSN2. So I've signed for all three of the drugs that I've now given at 0945. Great, so I'm just going to do my hand hygiene again before I interact with the patient. All right, sir, I'm going to keep you up in high Fowler, so that means sitting upright for 30 minutes while you digest that medication to make sure that you don't aspirate on those pills. I'm also going to bring your bed down to the lowest safe setting, so right down to the floor. Great, so your bed's nice and low. All right, sir, your call bell is right here beside you. Please do not hesitate to ring us if you experience any of those side effects or if you need anything else from us, all right? Okay, great. Thank you so much. Just doing a safety check as I exit the room, making sure that everything looks great, that the patient is in a comfortable position and they're not in distress. And I will take my medications out on the way. Okay, thank you.